Hello, this is Dr. Gabe from First Look MRI, and this is just a quick little case that if you're a radiologist, you should know what it is already. So this is a 52-year-old male who's had injury. He lifted some filing cabinet and just stepped the wrong way, and boom, he tore his quadriceps tendon. And he had surgery and now continued pain and not doing that great, very weak leg. And so we did x-rays here, and you can see that there is a problem. You can see here, this is the kneecap. Normally the kneecap will be up high up here, but instead it's dropped down, and so we know that the patella is abnormally low. So when they reattached the quadriceps tendon, it looks like it may have retorn, and we see some area up here that looks very thin and loosened. Normally the big quadriceps muscles come down here and there's more fullness, so it looks like it may be torn in here. We also see there is some brightness here. This is some thickening, which is abnormal as well. So here's too thick, here's too thin. This may be partly related to fluid, or maybe partly related to that quadriceps tendon. And here we have the kneecap that's too low. Normally it'll sit up here this high, so it's dropped down. And here's the MRI. We can see that the quadriceps tendon should be here. This is above the kneecap. Instead we see this fluid pocket where we should see a nice big dark quadriceps tendon. And on this side we can see where that slice is. It goes right through here. This is the kneecap. Normally the kneecap would be up here. The lower border may be about right here, but instead it's really low. The patellar tendon down here is chronically thickened, and we see that this quadriceps tendon, the muscle comes down, and then part of the tendon is here, and there's a big hole in the central portion. And this is the distal quadriceps tendon that's horizontal instead of vertical. So there's a nice big re-tear of the quadriceps tendon where they tried to reattach it. This is probably related to the prior surgery. This band here is containing the fluid, but a ruptured central quadriceps tendon, a re-tear in this patient who had prior surgery. Thank you very much.